We feel a very close relationship with our vendors. They brought us through the pandemic beautifully with supplies, but it is a collaborative effort that we have with them, and for them to respond to the policies and procedures that we have in place. We're not asking anything different of them than we ask of our own employees.
Without supplies, there's no surgery. Without products, there's no patient care. Welcome to Power Supply, the healthcare supply chain podcast focused on helping you navigate the intricacies of logistics, purchasing, contracting, and supplier relationships. Each episode, we speak with healthcare executives, supply chain leaders, and innovative entrepreneurs from across the country as they share their stories, experience, and expertise on the industry we love. From the loading dock to strategic sourcing, from buyers to the C-suite, and across the enterprise, we tackle the real-life issues impacting the healthcare supply chain. Whether you're tuning in for conversation or inspiration, we're glad you're here. You're just in time to hear it from the source and stock up on insight. So sit back and plug into Power Supply.
Today on Power Supply, we are going to be talking about vendor management and changes in facility access, which certainly has happened over the last 3 years. And we're going to have this conversation with Kim Smith, System Director of Business Sourcing Strategies in Supply Chain at the University of Kansas Health System and Hayes. I think Kim's going to be telling us a lot about not only the way things have changed over the last several years and why they haven't just completely opened up their facilities after now that we've gotten through the pandemic.
Well, they clearly have made some changes. You know, the good, the bad is there. And they have really, I learned a lot today about how they did it, why they did it, and some of the improvements that they're seeing right now. So please stick around, come in and join us, and you're going to enjoy it today.
All right, stay with us. We're going to be right back with Kim Smith.
Boom! I'm Hayes Walder.
This is Gary Skinner.
And I'm Justin Poulin.
From the studios of Healthcare HQ, you're listening to Power Supply.
Joining us now, Kim Smith, System Director of Business Sourcing Strategies in Supply Chain at the University of Kansas Health System. And Kim, you're joining us today. We're going to be talking about the changes in facility access and tying all that in to vendor management, which certainly has changed over the last several years. So thanks so much for coming on the show.
Well, thanks for having me, Justin. I'm really excited to chat about this today.
Well, we are, Kim. We're very excited to have you here. And one thing I was just going to have to just throw out there early on, I do know you're a fan of a particular football team. And well, can you kind of give me just a little background of what happened last weekend that might, was good news?
Well, the KU football team, absolutely. At KU, football hasn't always been our strongest suit, but last weekend we mastered the OU football team. We took out number 6 in the nation, and we ranked 22nd whenever the polls came out this week. So I'm really proud of my Jayhawks.
You mastered. I love that.
We mastered them, yes.
That's some swag from Kim early on there. That's really good. We mastered that. Yes, you did. Y'all played well. Congrats.
Thanks.
Well, my favorite basketball player of all time came from KU, Paul Pierce. So definitely a big fan. And, Kim, I'm a big fan of yours as well. And I'd love for you to talk about just your role at KU and, kind of how you even came into supply chain.
Absolutely. So my role here at KU as the System Director for Business Sourcing Strategies, I have 3 teams. One is operational sourcing. Traditionally, that had been called procurement in the past. Our operational sourcing team does so much more than just procure products. They are looking at opportunities to save money at every venture along the way. We manage freight. We look at the fee to spend ratios. We're looking at bill onlys, subs, back orders. All of that work is being handled by my operational sourcing team. I also oversee the consignment program, and we are formalizing the consignment program here at KU. Traditionally, in supply chain and supplies in general across the different departments, you'll have vendor managed products sitting on your shelves, as well as consignment. You also may have products that are consigned, and the same products are also owned by your system, and you'll have a mix of that family. Here at KU, we are working towards moving vendor managed to consigned, where everything will have a contract and established par level. So when the vendors are on site, their products will be on our shelves already. They won't bring them in via a suitcase or a bag. We will know all of the products sitting on our shelves at all times, which is incredibly important. So we're formalizing that program across the spectrum for all of our areas, and it's an exciting opportunity to really start to manage supplies here at KU in a very different way when you're talking about consignment. The third team that I oversee is a partnership with a contracted third party where they have small equipment that they manage, and we also lease from that team as well. So when you have a contracted team on site, they need to report up to a system director. And so I oversee and partner with them to ensure that our patients and our providers have all of the small equipment that they need at all times during the day.
I really like that standardization around that vendor managed inventory, loaner, consignment. That can be such a challenge. I mean, even for the vendor reps themselves, it can be a challenge managing that inventory, but let alone you all having visibility. And I think having that kind of structure and organization that you're putting into place, that's not easy to attain, is it?
It is not. And we are just starting that journey. But what we have found is the chain of custody, when you don't have control over that product, you don't know where that product has been sitting for however many days, weeks, or months. It could have been sitting in somebody's basement, in somebody's trunk, traditionally called trunk stock, on their garage floor. You don't know anything about that product. The other thing that concerns us is when they bring product in and it's not on formulary. It's not been approved by our health system to be on site. And that product could get used, and then we don't have any type of tracking on it at all. We're receiving a bill only invoice to pay for that. So we are taking control of all of that product here at University of Kansas Health System in order to keep our patients and our providers safe at all times.
So Kim, on this effort, if you will, y'all sat down, you blueprinted it out, right? So this is what we're going to try to do. When did that process start? How long is it going to take to get to where you really think you need to be? And then what are maybe some of the metrics you use to help make sure you're going in the right way?
So the metrics that we'll use currently, we keep very close track of our bill only spend. As we move to a consignment model, our bill only spend will go down and our consignment will go up. And that's how we will know that we are winning in this way, is minimizing our bill only spend. There will be a lot more structure to it as well. So it'll be more timely invoicing. There won't be question or concern whenever an invoice is submitted. We won't have a concern that we were overcharged for something, because it'll all be documented by our teams on site. We did just start that journey over the last 4 to 5 months. We've been planning it. We are meeting with each of the different section leaders. So most recently, we met with our leaders in the EP lab, not only from the health system perspective, so the nursing director and assistant director, but we also met with the physician leaders in that area. We shared the plan with them. Then we subsequently went to the first vendor and we said, this is what we would like to do. We are moving from a vendor managed to a consigned model. The vendors actually will be excited because they're going to have less responsibility, less paperwork, less carrying product in on their parts. It should be easier for everybody. We're not restricting the vendor, but we are restricting the amount of product that we keep on the shelf. So it minimizes our risk overall. I anticipate it will probably take us about a year to get there. We're starting with the procedural areas, and then we move into the OR.
Are there any other places outside the OR, the clinical suite, if you will, that has this consignment inventory? Is there any on the floors and any of that?
We have it in our EP lab, our cath lab, GI, interventional radiology, neuro-IR. Those are the primary areas outside of the OR suite, if you will. And so we will be tackling all of those procedural areas first, and then we will move into the OR.
And physician, as far as I guess they're on board with this, they don't have any issues at all. They probably would like it to knowing, it's definitely there.
Yes, we have not run into any issues at this point. It's really all about making sure that they're safe, that the products that they're using have a chain of custody as far as quality is concerned and expiration dates. It's on formulary. Overall, it's just really starting to take control over all of those vendor products that have been coming into the health system that have come in a lot of times without our knowledge. If you go into a health system, you can find vendor managed products in multiple areas, including drawers and closets that you might not know about. And we want to make sure that we're not finding any of that as we go forward, because anything that's on our property is our responsibility to know what's going on with that product. So if a regulatory body comes in, we need to know what's on our property and we need to be able to speak to it. And this is the way that we are going to always be assured that we know what's on site.
Yeah, it's a really proactive process is what I like about it. And I think to your question, Hayes, and your answer, Kim, on whether or not you're getting pushback from the clinicians, I mean, they just want to be able to do the procedure and know that they have what they need to do it. And so by having less surprises and more planning, everything should run more smoothly as a result of that. Plus, as you said, visibility to the inventory and what's on site. There's also visibility, and I know, this trends really well talking. I wanted to definitely explore some of that vendor management piece, related to the products, but there's also, access to facilities has changed a lot with vendors. And I know, for quite a time during the pandemic, everything was locked down. Very few vendors were getting in, only to support procedures. But I've seen things open back up. I think a lot of facilities are kind of returning to the way things were before the pandemic. But you told me that's not the case at KU. So what are you doing today, and why haven't you moved in a similar direction as others have started to go back to pre-pandemic access?
We made the conscious decision to remain a closed campus at this time. So only those vendor representatives that need to be on campus are allowed on campus, meaning you need to be supporting procedures or surgical type procedures, providing education. If you're monitoring a research project or visiting the pharmacy to monitor drugs, those types of things are still allowed. We have limited those representatives that are coming on site as toll sales. And so those individuals need to make an appointment with us, and primarily they need to identify the individual that they're going to see, the reason why they're coming, and they need to do that through our vendor managed system that we have in place here at KU. We feel that it's important that our providers have the ability to focus on their patients, and by remaining closed campus, that allows them that opportunity.
Yeah. What are some of the other changes that you've made? And I'm going to tie this back to the vendor managed inventory piece too, but what are some of the other changes that you've made that are kind of parallel to those decisions to remain a closed campus?
With our vendor managed product, we have eliminated health system badges being issued to our vendors. So in the past, our vendors that had a need to be in secured access areas were issued hospital system badges in order to allow them into those accessed or those secured areas. We have eliminated those out of the system totally. And so if they don't have a vendor pass that is through our vendor managed system, then they can't get into those secured areas. And our vendor managed system allows hard badges that have a chip, RFID chip in them. It marries up to our secured system, and we allow them access based on their time on campus. So if you are not here but once every couple of weeks, you don't have access to our secured areas, and you still have to go through the process that you would normally have to with picking up the phone, dialing the unit that you want access to, and then they come and escort you in. Only if you're on campus 4 to 5 times per week will you be allowed access into our secured areas without needing to have an escort bring you into the system or into those areas. That's one of the biggest changes that we've made. So that has really cut down on the amount of traffic in our secured areas as well, which is important because those areas are very busy. They're very focused on their patients, and answering the need of the vendor constantly is not something that they should have to do.
What kind of feedback did you get from the vendors? I mean, at some point they got to be like, hey, how am I supposed to reach you guys? Right. So, I mean, I'm sure that there was some frustration around remaining a closed campus and having these tight level of controls. Did you get feedback on it?
I haven't got as much feedback on it as I anticipated. We just continued to remain closed and kept telling them that. And for the most part, if they need to visit us, they make an appointment through supply chain. And that's the biggest change, I think, is they need to make an appointment through us, or they need to have a contact established within the unit. Cold calling is not appropriate. And we have made sure that we have messaged that out to the different teams, and our end users really like that. In fact, they have my email address and they have my phone number, and anytime that they get a cold call coming into their unit or into one of the ambulatory areas, they send me an email. They have oftentimes taken pictures of their cards or their badges, and I send a message back out to not only the vendor, but I also message their manager as well. And that's really, really important that they understand that there are policies and procedures that they need to follow here at KU. They are guests on our campus. And I know that could sound harsh if you're a vendor rep listening to this, but you really are a guest here, and we need to keep our focus on our patients and allow our providers and our teams to focus on our patients. They deserve that.
Well, you're doing it for the right reasons, right? I mean, you're not doing it just to say, no, you cannot come here. I mean, you're obviously doing it for reasons. And this question might be for Justin too, and Kim, either one. You know, these safeguards we put in place and these things that we've done here are all these different health systems. Do you have a case, or do you know of a story of where it really, would stop somebody in their tracks for doing something wrong? Have you ever had experience that, you know, the safeguards you've put in place actually prevented something, you know, maybe potentially really bad from happening?
I don't have an example of that. I will tell you that I think it's incredibly important, and we would not have survived the pandemic without great relationships with our vendors. But there's a mutual respect that has to be there. And when a vendor oversteps, if it's egregious enough, I have fired a few. But it's important that they understand that mutual respect piece, but that their success relies on our success and vice versa.
Absolutely does. Absolutely does.
So how do you find new vendor suppliers to work with? How do you maintain communication with the reps? I mean, I think those are all questions that people would ask is if they're not coming in without an appointment, how do they get an appointment to begin with? And how does that work? I mean, I'm trying to think this through also from the vendor's perspective. Like, I'm sure you have appropriate channels for all of that, but that's like, I think some common questions is like, well, how do I reach the person I need to talk to?
They can reach out to us. We have a website and they can reach out to supply chain anytime they need. We have a system in place where if they want to bring in a new product, they have to reach out to the physician and communicate with them. The physician places the request for this product, and then it gets reviewed by the value analysis team before we allow them on site to utilize that product or before it's approved for use on our campus. Physicians go to the different conferences, and so they're connecting with these vendors. I think that's probably the best way. We all, as supply chain professionals and healthcare professionals, are going to conferences. So the reverse vendor fairs, I think, are fabulous, and that has become quite popular over the last several years to do the reverse vendor fairs. So I think that is a great way for them to connect with us as well. But they find their way in. They find their way to connect with us. I receive email and communication routinely from vendors that I've not met before, but that they want to do business here with KU, which is great. That says a lot for our organization that you want to do business with us. We are the largest healthcare provider in the state of Kansas, and certainly the largest healthcare provider within the metro area here in Kansas City. So the want to do business with us is great, and we want to have cutting edge technology. We just want it brought into our campus the right way.
Yeah, follow the protocol.
Exactly.
Would you venture to guess, Kim, how many outside emails you get a day or a week from companies? You have a venture a guess?
I probably get between 50 and 100 a week, I would say, on a good week. And that's probably a really busy week. During the holidays, it does slow down. But after I've been to a conference, it's really, really busy.
Yeah, that's typical. Yeah.
Yeah. So you mentioned how you were focused on bill only POs and kind of getting a handle on that, and even your KPI for the consignment initiative that you've got going is to have a higher amount of consigned and a lower number of bill only POs. Do the bill only POs tie in at all with what you're doing related to the actual access to your facilities and how you were talking about integrating your access control system?
Oh, they absolutely do. One morning I figured out that every time a vendor submits a bill only, that means they've most likely been on site or one of their partners has been on site. And so we took a report from our vendor managed system and we married it up with our bill only submitted. And if the vendor submitted a bill only, but I did not see them checked into our vendor management system, I tagged them. I sent them an email. And if I saw it a second time, I sent them an email and I sent their manager an email. And a third time was not going to bode very well for the vendor. And it did not happen that way. They realized very, very quickly that they needed to be checking in to the vendor managed system. Before the pandemic started, we had an antiquated system and we calculated about 6% of the time we were having vendor check-in. And now...
Wow, 6% of every visit from a vendor?
So extremely low.
It was very low. I can tell you now that when I started tying it to bill only, that number went up drastically as far as compliance was concerned. We had 100% compliance after I started tying it to bill onlys. It was amazing. And they know who I am without even having to introduce myself sometimes in the hallways. But that was the other thing that I did. I started going down to the areas where I knew the vendors were congregating. Sometimes it was their coffee shop in the health system or waiting space. It's very obvious who our vendors are. And again, we want to partner with them, but we want them to follow our policies. And so I just would spot check to make sure that they had checked in. And quickly, we gained compliance. It did not take very long before we started seeing a significant increase in our compliance.
Well, Kim, maybe just for my understanding, how do they check in with you? How easy is that, and how do y'all do that?
It's actually pretty easy. I mentioned the QR code on the vendor hard badges, so they're able to walk up to the kiosk and check in and go about their business. We also tied, and this was the other piece after I tied bill onlys to vendor check-in, we also now have our scrub machines for our vendors tied to our kiosks. So the only way they can get a set of scrubs is through check-in. And that was a cost savings for our health system as a whole. We were supplying scrubs to our vendors, and now they purchase their scrubs. So you can't get a set of scrubs unless you check in. And the scrubs are a different color from what the health system issues to the different teams. So they're very identifiable. And we also have a paper badge that's printed that expires. So once 24 hours has expired, that paper badge also fades. And so they're very easily identifiable in our system going forward.
All right, Kim, you got this figured out. You've got, I'm highly impressed. And they're going to play by the rules if they come to Kansas there for sure.
That's all I ask. And if you play by the policy, then, we're going to welcome you in each and every time.
Yeah. I love it.
I love it. Yeah, I can really see how you've tied this whole initiative. It's like, well, the access is one piece, but, you're really expanding on it. I think a lot of the things that you're talking about, even how you're taking a handle on the consignment, is just very forward thinking. And, I know a lot of people kind of worry about vendor access from a vendor's perspective. We used to hear the repless model, but I think that makes clinicians just as afraid as it might vendors, right? It's like, well, these vendors are coming in and providing us, with knowledge that we just, how can we possibly be experts on every single product that comes in? And as we make changes and try to scale with the, innovations that are coming out with technology, we kind of need that support. And I haven't really heard people talk about the repless model for quite a while now, but I want to say, and Hayes, you can you can back me up or confirm this, but I feel like it was only like 8 years ago that was a really hot topic, especially with the whole pre-pandemic move to try to consolidate SKUs and take that vendor master and pare it down. But as Kim noted at the beginning with the back orders and everything else, we almost don't have that luxury anymore. But I don't know, wasn't it about 8 years ago, like that repless model conversation was pretty intense?
Well, yeah. I mean, everybody was trying to figure out, how to shave off a few points and margin there. And then it really got white hot in 2020 with the virtual rep, having the kiosk that they could wheel around, and there's some really innovative companies that were in that space trying to prevent the rep from being actual in the OR. And so I still think that's applicable in some cases potentially, but I just like what you've done. I mean, you're not doing this to punish anybody. You're doing this to run an efficient, safe organization. I mean, that's the thing about it is, you just don't want random people walking around in places they're not supposed to be for a lot of reasons. And you want to make sure that the implants, the instruments that are in the OR are supposed to be there and they're billed correctly and all that. So, I mean, I applaud you, but I like the way you've done it all together. Honestly, again, I think I used the term blueprint earlier. You've really mapped this out really well.
We tried. We feel a very close relationship with our vendors. They brought us through the pandemic beautifully with supplies, but it is a collaborative effort that we have with them, and for them to respond to the policies and procedures that we have in place. We're not asking anything different of them than we ask of our own employees. We ask them to follow our policies and our procedures. We ask for them to provide us the information necessary so that a solid background check can be done, and to keep up with their immunizations or to sign a declination form. So we want to work closely with them. Our physicians need them. Certainly we rely on them for education and sometimes that trunk stock, but we want to move to a place where we aren't relying on them for so much of that trunk stock, but we still rely on them for that education and support when it's necessary.
Well, I can say a little bit. It's been a while, but I used to have a little trunk stock back in the day. It used to be in the garage. It used to be in this trunk. And so I hear that, but I will definitely stick up for having, a good qualified rep in the room can really, really make a difference. I mean, I was that guy years and years ago, but, I think Justin said it, you've got sizes, you got instruments, what works with that? How do you trial this? Does this work with that? All those things that there's just no way that someone, unless they do hundreds and hundreds of them, would know all that stuff. And so there is a role for them for, having qualified good execs there doing what they're supposed to.
And wouldn't you have rather been in the operating room than driving your trunk stock around? I mean, just how you spend your time. And to Kim's point, I think the vendors that are working, with KU are probably focused more on the things that they enjoy doing that are less remedial. Cause that management of that trunk stock can be, kind of the mundane part of the job, right, Hayes?
Well, absolutely. It's mundane, but frankly, it's so much safer for the patient because let's just say, you have a situation where you're missing 3 sizes or of whatever. And then all of a sudden, you got a patient on the table, it's open and you don't have that size because you're still driving over, and you forgot to replenish it or something. Having it all on there and you guys knowing where it is before you open, that is so valuable. I mean, I've literally been sitting at FedEx before talking to a doc on the phone and go, don't open yet. Don't send them back yet because it's not here yet until I get it in my hands. That's awful. That's the hard part of being a rep, but that is a service. But I love the idea of knowing that, listen, it's all there. It's just, drop ship probably directly to the hospital and I don't have to deal with it. That's to me, that would be a really, really good thing.
Yeah. And we're looking at our historical data and we're marrying it up to the vendor's data as well, just to make sure that when we move from this vendor managed to a consigned model, that we do have the right parts on location at every juncture along the way.
Yeah, I like the mutual accountability of that too. Honestly, it's just a little bit more balanced in terms of ownership. And I think that's really a great model as well. All right, Kim, as we wrap up, anything you want to add or maybe any other benefits to this change in access that you might want to bring up? I want to make sure we kind of get to everything that you've obviously thought this well through in the way that you've created an integrated model for it.
Yeah, I think the greatest advantage for us at this point, outside of what I've already chatted about, is the fact that our reps now know the supply chain professionals here a lot better. Some of them may not have known us at all. And so now there's a mutual respect that they can have with supply chain as well as the physicians and the frontline team members. So there's a great relationship that has been built. And some of it has come because the pandemic was here, but a lot of it because we've established a really solid vendor managed system here that marries quite nicely with what we're trying to do with bill onlys and consignment.
Yeah. Yeah. I love that the benefit is that you got improved relationships and better communication for the vendors and that they know how to find you. I think that is just an excellent way because you never know when the next challenge might surface and those relationships will come in extremely valuable versus, reaching out to your clinical counterparts and saying, okay, this is coming up. Who do we need to call? Because you don't know who to reach out to and it's all triangulated. I can see in a lot of ways you'll move much more efficiently with a sound operation like this. So Kim, great job. Thanks for coming on the show.
It was my pleasure. I've had a great time. Thanks so much, Justin and Hayes.
That was Kim Smith, System Director of Business Sourcing Strategies at the University of Kansas Health System. And Hayes, I just think the way that she's built this integrated model not only for access control, not just for managing vendors, but even managing their data. I mean, you can just hear the way that they're curating that and taking a really proactive methodology forward to not only the data, but also their vendor relationships. And I love the fact that one of the major takeaways for them is that they've improved their relationships and they actually know the reps that are coming in to the hospitals because they've, got kind of a vehicle for interacting with them as regularly as the clinicians do.
Yeah, I loved it when Kim said, she goes, I'm being recognized in the hallway now, because she's interacting with the companies. But, I think I even said this. If you were to design a brand new company, a brand new hospital from scratch, this is how you do it. And she did a great job with the help of others. And to your point, it's facilitating the conversation, the communication, the money, the data, all of it's flowing together. And they have done a really good job putting it all together.
Agreed, Hayes. Kim was an excellent guest, and they've got a well-oiled machine going on over there at KU. And so want to thank you all for listening to this week's episode. And on behalf of Hayes and myself, I want to thank everybody for listening to this week's episode of Power Supply.
Thank you for listening to this week's episode of Power Supply. As a reminder, you can help support us by subscribing on your favorite podcast app or by downloading the smartphone app on your iPhone or Android. Simply search for Power Supply in the App Store or Google Play. The best thing about downloading the smartphone app is that you can access bonus content for certain episodes and view episodes in certain categories, like articles on the go and vendor spotlights. Are you following us on LinkedIn or Facebook yet? If you are and you love an episode or post, then let your social network know about it. Like, comment, or share our posts along with your thoughts and keep the conversation going. If you have any topics or guests that you would like to recommend for a future episode, just send us an email to info@powersupplymedia.net. We look forward to hearing from you.